So how does SBRT compare to, for instance, radiofrequency ablation? We were very interested in this at the University of Michigan. We have competing modalities for the treatment of single or two liver metastases. And we looked at 127 patients treated with RFA within this period of time versus 62 patients treated with SBRT. Again, this is how patients were treated at the University of Michigan with ABC, 20 gray times 3 or 10 gray times 5. These were the most common regimens. If you do this with a radiofrequency ablation, you need usually general anesthesia, ultrasound guidance, an electrode system. You need margin sizes, and it's a little bit more involved procedure. These are the patient characteristics. I'm going to skip this. They are fairly matched patients. The median tumor volume was 9 cc. So the diameter was 0.2 to 7.6 centimeters. The dose was quite high. The median BD was 100 gray. And these are the results. You see that the 2-year local control, freedom from local progression rates, for RFA is 83%, for SBRT is 84%. So essentially, they are identical. This is on the right-hand panel. If you look at hepatocellular carcinoma, the results of SBRT are actually better, or at least they seem better in this small series. And interestingly, it's highly dependent on size. So what you can see in this plot is that patients with lesions more than 3 centimeters in size actually do far better with SBRT than they do with radiofrequency ablation. And the complication rate with stereotactic body radiotherapy is far lower than it is with radiofrequency ablation, 0.9 versus 3.9, and they actually had a death within 30 days of RFA in the RFA series. So in conclusion, SBRT achieves excellent local control with low toxicity. SBRT is more effective than radiofrequency ablation for liver tumors more than 3 centimeters. And finally, you ask yourself, so what are the long-term results of SBRT? There are not too many series or trials that have looked at that, but I picked one. In patients with liver metastasis from breast cancer, for instance. And I'm just showing here the local control rate at 6 years is 87%. So if you look at these patients who live long, you could see that the excellent local control is maintained over long periods of time. I have more. I can show you here more data, but I think we're running out of time. I just want to highlight a trial in colorectal metastasis, which shows also superb results, and maybe you can look up this excellent paper by Scorsetti on your own. I think that's all I have. Thank you very much.